we'd like to welcome our keynote speaker, Dr. Anna Mavrogianni, for a second time today in this live session. This time, this is a research talk, and I will say something about Dr. Anna. She is an associate professor in sustainable building and urban design at the Institute for Environmental Design and Engineering at the Bartlett Faculty of the Built Environment, University College London. She's been a trained architect engineer specializing in building physics and environmental design at the School of Architecture at the National Technical University of Athens and at the Bartlett School of Graduate Studies. Her research, she has been leading interdisciplinary research in building performance analysis used by policymakers to evaluate impacts of energy efficiency, urban growth, and climate change on energy use, carbon emissions, health, and well-being. So today she will have her presentation on climate resilience and indoor environmental quality in buildings occupied by vulnerable populations. We are looking forward to your presentation. And you can share your screen. I think they will give you the access.
Great. Thank you so much, Nesrine, for the introductions and also for inviting me to give this talk and participate in this virtual conference. It's really nice to be here, even if it's virtually. So please let me know if you can see my full screen.
Yes, it is very clear.
Great, thank you so much. And perhaps some people from the audience heard me speaking in the morning about our MSc program. Deputy Program Director for the MSc in Health, Wellbeing and Sustainable Buildings at the UCL Institute for Environmental Design and Engineering. But for this presentation, I'm going to focus on past and ongoing research I've been carrying out on the climate resilience and indoor environmental quality in buildings with specific focus on vulnerable populations. So yeah, thanks again for the introductions. This is an outline of the talk, so I'll first introduce some of the current challenges we are facing, both as a discipline as well as a society more broadly. I will then give an overview of those past and ongoing projects. I had a bit of a think in terms of how to structure this talk, so I decided to do this by building type, purely because each building type has specific challenges and characteristics. So I'm first going to talk about housing, then about care homes, and then about some more recent ongoing work on schools. And I'll add with some of my thoughts about the current research needs and what I think we should be focusing as a discipline in the future. So what are the current challenges we are facing in the built environment? So of course, climate change. So we know that anthropogenic climate change will increase the frequency and intensity of extreme weather episodes, and it's going to create unprecedented challenges for humanity. So in particular for the UK, as well as for many other previously heating-dominated climates, we will experience warmer, wetter and windier winters, but also much hotter and drier summers. And of course, we have the precedent of the 2003 heat wave in Europe, where the extreme hot spells during that event were unprecedented and led to a very large number of excess heat-related mortality. Around 20,000 are estimated across Europe, and with countries such as France and the UK particularly affected. And according to current climate change projections, we expect summers like this to have become common by the middle of the century. So summers such as 2003, 2006, and more recently in the UK we had the heat waves in 2018. So this will become the norm by the 2050s. In addition to this, in many countries around the world, we also have overheating trends exacerbated by what we call the urban heat island effect. So this is very important because cities worldwide are expanding rapidly. We know that 70% of the global population are projected to live in cities, again, by the middle of the century. So this is going to affect a very significant part of the population. Of course, the COVID-19 pandemic has posed, again, unprecedented challenges to the built environment, and it's also likely to have long-lasting impacts on the way we inhabit the built environment. I've seen some reports and some hypothesis about potentially people moving away from urban areas, some sort of reverse urbanization happening. But again, we don't know whether this is indeed going to last and to what extent, to what scale this is going to be. But based on current urbanization trends, the urban heat island effect is really important because it could potentially magnify the risk of overheating due to background climate change. So the urban heat island effect is a well-established phenomenon of inadvertent climate modification, which is linked to urbanization. It's linked to the changes we as humans make to our cities. And it is defined as a difference between temperatures measured in a core urban area and those measured in an adjacent non-urban green area. And this temperature differential is called the urban heat island intensity. And this map is there. I actually produced for my PhD many years back. It's a map of the Greater London area, the summer of 2006, and it shows land surface temperatures across the city. And you can see how temperatures very closely follow the underlying topography, and how green areas really stand out because they're much cooler, what we call the park cooling effect. So in addition to these two trends, the UK and also a lot of other countries around the world are characterized by a rapidly aging population. So we have single household growth, and this can lead to increased demand for care provision in old age. So increased demand for care homes and extra care homes. And we know that older populations are more vulnerable to heat stress. During a heat wave in particular, we know that people above 65 years of age are the most vulnerable to heat stress, according to epidemiological studies, in addition to people who suffer from chronic conditions, such as respiratory and cardiovascular disease. So I think it's really important to consider climate vulnerability and inequalities. So this is a diagram from IPCC that shows that multidimensional vulnerability is driven by intersecting dimensions of inequality. So vulnerability increases when people's capacities and opportunities to adapt, cope, and recover due to various climate change events are diminished. And it's really inequality can be a function of a number of factors, including gender, class, ethnicity, age, race, and potential disability. So it's really important that I think, on the one hand, climate change and also other health crises such as COVID-19 not only have shed light on entrenched disadvantage and existing systemic inequalities, they have also created new vulnerabilities, and I think this is really important to note. And interestingly, there is also an overlap between heat risk and COVID risk factors such as age and suffering from respiratory conditions. But what is the role of the indoor environment in all this? Well, the indoor environment is a principal moderator of heat exposure. And this is particularly true and important for older populations that might tend to spend the majority of their time indoors. So in countries such as the UK, again, heating dominated climates, people estimate that we probably spend around 90% of our time inside buildings. So the built environment really plays a very important role in our exposure to external temperature, pollutants, and so on. But of course, this percentage might be even higher for older people or people who are considered low mobility or bedridden, etc. And initial evidence from our work at ID and others indicates the new build, more energy efficient residential and care settings today under the current climate are already experiencing problems with indoor overheating. So this is true even under non-extreme summer periods. So it's likely to be even more severe during a future heat wave. And of course, these risks will be exacerbated due to ongoing and future climate change and potential heat island effects if a building is located within an urban area. And what we find that is missing, based on our discussions with industry and policy stakeholders, is that there is a lack of simple, easy to implement guidance on how to design and retrofit buildings occupied by vulnerable people for a changing climate. And of course, taking into account all those additional complex layers of risk associated with, for example, the COVID pandemic. Indoor overheating and poor indoor air quality are growing problems that can lead to a wide range of adverse effects for human well-being, and they affect a range of stakeholders, including the construction industry, social landlords, the healthcare sector, because they can create a significant healthcare burden, building owners, and of course the inhabitants of these buildings. But of course, there has been increasing recognition of these issues across both policy and industry sectors. And here on the right, you can see a range of UK publications to which I have personally contributed or colleagues have contributed. And of course, the establishment of the WELL standard recognizing the importance of healthy buildings. So things are shifting, perhaps gradually, but other academics have described this issue of indoor environmental quality as a perfect storm of interacting factors, as a toxic cocktail, if you'd like, of different factors. So, as I said earlier, there is climate change, urbanization, urban heat island effects. But in addition to these, winter energy efficiency targets. So, as I said during the panel discussion we had in the morning, we are, of course, trying to reduce the carbon emissions from our buildings. And I think this is really, really important in terms of climate change mitigation. So we are applying a range of energy efficiency measures, such as increased thermal insulation, air tightness, etc. And I think these are really important. But perhaps what's missing is a holistic approach, an integrated approach towards building design and retrofit. And of course, there is this constant drive across most countries in the world to reduce construction costs and cut corners. So unless there is appropriate regulation behind it, some measures, such as passive design measures, are perhaps the ones that are first to go. And of course, issues such as increasing land and housing prices and lack of technical skills. So really our workforce needs upskilling in order to be able to implement those passive design measures in order to achieve buildings that are both low carbon, low energy, as well as healthy and comfortable and safe. And in addition to this, I think what's really important, and I say that coming from more of an architecture/engineering background, I think what is really important is that in countries such as the UK, but also perhaps elsewhere, there tends to be a socio-cultural lack of knowledge about heat and indoor air quality. So in currently heating dominated countries such as the UK and most of Northern Europe, people see heat and overheating as something potentially pleasant. So because if you're in the middle of the winter and it's raining and it's very miserable, you don't really see it as a problem. So people are not very good at assessing their own risk potentially. And of course, issues such as indoor air quality, both heat and indoor air quality, are invisible problems. Other climate risks, such as flood risk, for example, can be visualized. So we tend to be more aware of them, whereas people are not very good at assessing temperature or the concentration of indoor air pollutants in a room. And therefore, a risk perception is kind of a tricky subject there. And I come from Greece, of course, a much warmer country than the UK, even though I've lived in the UK for a decade and a half now. And I think there's a big difference there in terms of social norms and habits and daily practices in a country where heat waves tend to be quite common. So society is adjusting to the climate, and buildings and infrastructure and even the urban environment are adapted to this much warmer climate. Whereas in countries such as the UK, existing buildings are designed for a much cooler climate. They have been optimized throughout the centuries to capture heat gains, capture solar heat gains, and so on. So they're not really ready for a much warmer climate. So this is a significant problem we're facing with current climate change projections. So I'll now go through, I'll outline the various projects that we have developed over the years in order to address some of these challenges. And this is perhaps my clumsy attempt, if you'd like, to outline the various research questions we have been formulating. So in general, if I was trying to describe some of our research, the majority of our research it's trying to answer the question, what is the relative contribution of background regional climate change, local urban climate conditions, building energy retrofit measures, and inhabitant behavior on factors such as space, heating, energy demand, thermal comfort, indoor air quality, and the health of the occupants, as well as their productivity at the building, national, or citywide level. And this table summarizes the three main projects that I would like to present today. So the first one has started a few years back, and now we're on the second phase of funding. It's funded by the National Institute for Health Research in the UK, and it's a Health Protection Research Unit in Environmental Change and Health, HPRU, and it's focusing on housing in particular. The second project, it's actually two projects. There is a pilot project that ran last year called Climate Resilience of Care Settings. And recently in May, we received funding for a larger scale follow-up project called Governing the Climate Adaptation of Care Settings. And it's funded by the Natural Environment Research Council. And it's quite novel in that it focuses on care homes and extra care homes, which is a building type where there hasn't been a lot of research done, especially in the UK. And last, I'm also the principal investigator for a 2-year project funded by the Engineering and Physical Sciences Research Council called Advancing School Performance, Indoor Environmental Quality, Resilience and Educational Outcomes, or ASPIRE for short. So I'll now go through those three main projects, talking about homes, care homes, and schools. So I'll start with housing, where the first stage of the HPRU project has been completed. So the aim of the kind of the work packages I was involved in was to map indoor overheating and air pollution across English housing. And in order to achieve this, we developed a building physics-based housing stock model using National Housing Survey data. And of course, there were other components of the project, but I'll just focus on the aspects that I was personally involved in. So this kind of gives you a summary of the last 5 years of the HPRU work. I won't go into a lot of detail, but I'll just perhaps say that the first few years were focusing on the development of the model, of the housing stock model. We initially looked at indoor overheating mapping, and then we expanded the model to also look at externally and internally generated pollutants. And this slide kind of I know you probably can't read the text there, but it summarizes the structure of our building stock models. So we use geographic information systems, GIS, to extract data about buildings from maps. And we're extracting information such as the construction age band they belong to, the building type, so if it's a terrace versus a detached house, the number of stories, and so on, and their footprint. And then we use literature on building architectural types and typologies to develop the internal layouts, and then we infer based on factors such as age and build form. We infer a number of missing variables using, again, existing literature and tables in existing documents. And then following this, we also we have adopted an archetype approach. So we have developed a range of archetypes that are broadly representative of housing typologies in England. Yeah, again, this summarizes our approach. Of course, in order to run this model, we use those inferred variables as inputs into dynamic building performance simulation, and specifically we use Energy Plus. We like it because of its open access nature, and because it's widely tested and validated. But of course, as you can imagine, it's quite time and computing intensive to carry out simulations for all buildings in the stock. And to achieve this, we have adopted a meta-modeling approach. So we have developed a meta-model that replicates the results of the original models. So we have tested a number of meta-modeling techniques, and we've calibrated and train them using a number of data sets. So this presents some of the detail we have published widely on the approach. So I won't go into a lot of detail here, just to say that we use monitor data from the English Housing Survey Energy Follow-up Survey that contains data from 823 dwellings. It's quite a rich data set. So we use this to compare and assess the effectiveness of our meta-modeling approach. So this approach is really a very powerful tool for assessing changes and transformations to indoor exposure profiles that may be caused by different policies, climate change scenarios, and building stock and urban environment transformation. So we'd like to think it's quite a powerful tool that we can use with policymakers and other stakeholders to assess the effectiveness of a wide range of interventions. So I'll now go through some of our findings. So this is from a preliminary study we did looking only at London, and we found that, of course, the dwelling type and the urban heat island both have an impact on the spatial variation of relative risk of mortality due to hot weather. However, it was dwelling type that had the greater influence on exposure. So it's more important, the building that we occupy is a more important modifier than our location within the heat island for temperature exposures. And this is another study that we carried out at focused on the West Midlands housing stock. And the aim of this was to evaluate energy efficiency retrofit and overheating mitigation strategies. So what we found was that a full energy efficient retrofit package reduced domestic space heating energy use by around 26%. So that's great. But it also led to a marginal increase in summertime heat mortality by around 3 or 4%. However, when these retrofit measures were combined with passive cooling strategies such as the addition of external shading, in particular external shutters, there was a significant reduction in heat mortality, 37 to 43%. So I think that the takeaway message is that we should still go ahead with energy efficiency retrofit, insulation, air tightness, and so on. But these changes really need to be combined with passive cooling strategies, and the fact that external shutters tend to be very efficient in reducing overheating risk is something that I'd really like to emphasize. And this corroborates findings from previous studies as well. And again, from the same set of studies, we found that adequate post-retrofit ventilation, again, the installation of shutters, and ensuring operable windows in homes with heat-vulnerable occupants can simultaneously save energy and also significantly reduce heat-related mortality and morbidity risk. So in this set of papers, we expanded the model to the national level, and we explored the relationship between indoor temperature and dwelling characteristics. We found that bungalows and top floor flats were the most vulnerable to overheating, alongside with more recently constructed, very airtight terrace dwellings. So it was the dwellings that were either very sheltered and very airtight, or the dwellings that were very exposed to the external elements. And we also found that pollutant infiltration can strongly be affected by wind exposure, which means that there are higher levels of indoor pollution from outdoor sources in rural areas, and vice versa. So dwellings in urban areas have higher concentrations of internally generated pollutants. And this is a further model adaptation that includes indoor air pollution from outdoor sources, in particular PM2.5 and nitrous dioxide, and indoor and outdoor sources, carbon monoxide. So we found that indoor NO2 concentrations are higher in London homes, and housing has a greater modification of externally generated PM2.5 than for NO2. And also the energy retrofits without added ventilation could significantly increase carbon monoxide exposures. Again, this highlights the importance of ventilation, especially following energy retrofit. So I'll now go through the second project or set of projects that focus on care settings. So the aim of the pilot ClimaCare project was to undertake feasibility work by developing a range of novel methods, knowledge and insights so as to enable care provision in the UK to become resilient to rising heat stress under climate change. So in order to achieve this, we had a range of objectives, and we really adopted a mixed methods approach. So the first work package carried out summer thermal monitoring, hygrothermal monitoring combined with surveys with frontline care staff, managers and residents about their thermal comfort and adaptive capacity. Then further novel approaches to understand the comfort levels of care home residents, as well as some physiological measurement techniques, focusing on the relationship between temperature and health. Building performance simulation, that was the component I was mainly involved in, so as to test methods to assess future overheating risks in those care settings. And last but not least, the combination of multidisciplinary research perspectives with those of care home practitioners and other stakeholders such as policymakers, public health and construction industry practitioners. So this map there shows our 5 case studies that were recruited for the pilot project with some help from the Care Quality Commission, CQC. And unfortunately, I can't share the exact location of those care homes or any photos because of the for confidentiality reasons. But we were quite happy because even within such a small sample size, we still achieved a range of characteristics in terms of occupant capacity, so the size of the care home, the building typology, and the construction age. So you can see that we had some quite big and some relatively small care homes. Some very old, 1348, that of course were later on converted into care homes. So, and a mix of converted versus purpose-built buildings. And so this there is a hobo data logger. Perhaps some of you are familiar with this type of data loggers there on top of that door, that was used to monitor temperature, relative humidity, and carbon dioxide levels. We carried out a survey to record the perception of thermal comfort during the summer of 2009, and a number of semi-structured interviews with care home managers, the frontline staff and residents to understand how overheating is currently managed, and also to assess barriers to the implementation of heat risk mitigation strategies. Of course, I have to say that this was all completed pre-COVID, and although I think that some data loggers might still be there, it's not currently possible to go to visit these care homes or recruit new ones because, of course, they're hotspots of COVID risk and kind of no-go zones at the moment. But we are currently assessing the situation as it's evolving. Today is the start of a lockdown here in the UK, and we are developing contingency plans to see how we can continue with our research, potentially using remote data collection techniques, etc., or online workshops. This slide summarizes the modeling work we carried out in the context of the ClimaCare project. So we carried out dynamic building performance modeling using, again, the Energy Plus platform via the Design Builder Graphical User Interface. We used a number of weather files representing the current and future climate. The future climate change projections were based on the UK Climate Change Projections 2009. We have some more recent projections published recently, the 2018 ones, but unfortunately they're not yet formatted they're not available in a format suitable for building performance simulation, but this is something that we can update moving forward. So we used one weather file representing an urban location and one representing a peri-urban location for a range of different timescales and emission scenarios, such as 2020's high emissions, 2080's low and high emissions. And what we really wanted to represent was the kind of the current conditions, and then a kind of a typical versus an optimistic versus a worst case scenario in terms of climate change. And building fabric inputs into the model were dictated by the data we collected through the building physical surveys. So this table here, I know it's quite detailed, but it summarizes the interventions that we tested. Of course, they're not exhaustive, and we hope to expand this during the ongoing project. But in summary, they included both what we call non-structural soft, perhaps what we call the low-hanging fruits, easy to implement, low-cost, minimum effort solutions, and structural, hard engineering solutions that might be perhaps more disruptive, more expensive, and more time-consuming. And we group those interventions as, of course, we have the base case, and then strategies aiming to minimize internal heat generation, the majority of which are based on behavioral change, strategies aiming to keep the heat out, managing heat, passive ventilation strategies, and then we had some additional simulation rounds looking at the cumulative impact of these strategies. And again, this kind of summarizes the range of strategies we tested. So again, internal heat sources such as switching radiators that are not needed, switching them off, modifying the external facade albedo, insulation, shading, thermal mass, testing different ventilation regimes, the addition of green and blue infrastructure, and of course active cooling options, so the insulation of air conditioning, etc. So now some outputs from the pilot work. So this is a graph that summarizes some monitor data, and what we found was that occupants in the older, more heavyweight buildings were less likely to feel hot in the summer. They tend to be more satisfied with the indoor thermal conditions. But interestingly, we found that summer daily maximum temperatures were rising above the 26 degrees threshold that's currently recommended by Public Health England. So those care homes are already overheating. And although we recognize that this is a small sample, it's quite a concern. So we'd like, of course, to test, to monitor temperatures across a bigger sample, but it's quite concerning. In terms of our pilot modeling results, we found that older buildings appear to benefit more from the application of high albedo materials, whereas the more recently constructed buildings were benefiting more from higher ventilation rates combined with external shading systems. We also found that the most effective set of measures lie in the area of passive ventilation and heat management. And the single most impactful measure for all 5 case studies was the implementation of night ventilation, followed by the implementation of increased ventilation rates and the application of internal door rules, so optimizing the use of doors for ventilation. So I think this is quite important. Of course, it comes with a number of caveats, in the sense that we also need to consider issues such as security, safety, so it might not always be feasible to keep windows open during the night in these settings. Of course, the fact that in order to achieve effective night ventilation, you need to have high thermal mass as well as a significant drop in external temperatures during the night, which might not always be the case for some climate change scenarios, and so on. So there are many parameters that we need to test, but in an idealized case study within our building performance simulation software platform, this is the strategy that appeared to be most effective. So again, a summary here of our pilot findings. So temperatures remained predominantly above the threshold currently recommended for this type of settings. So there is a concern there that it could lead to a number of adverse health effects for vulnerable residents in these settings. The combination of soft and hard engineered passive strategies appeared to be capable of reducing the residents' indoor temperature exposure from approximately 1.3 to 4.4 degrees Celsius. A question, however, was raised whether this would be enough under the more extreme climate change scenarios, and whether at some point active cooling options will need to be introduced in order to maintain a healthy and comfortable indoor environment. Of course, again, please note that the range of measures we tested was not exhaustive, but we'll expand this as we move forward with the project. We also have produced a number of resources for the ClimaCare project. So this is our website link where you can check for updates and publications. And we recently also published a report for the Greater London Authority, for the Mayor of London, where we presented the work we did with one of the case studies in more detail. So this audit pilot project functions as kind of a foundation for the further work we did in the project, and also a research insight document for CIPSI, which can be downloaded for free online. You simply need to register. So both reports are available online for free. Now, in terms of next steps, with the ongoing larger-scale follow-up project, we aim to quantify climate-related heat risks in care settings nationwide. So we'll go for London to the national scale, and we would like to build a strategic multi-stakeholder platform that will involve all actors participating in the creation, provision, and maintenance of healthy and climate-resilient care settings. And we'd like to achieve to generate impact along three main pathways, creating best practice guidance and decision-making tools for building construction practitioners. And we're working very closely with CIPSI and other organizations in order to achieve this. Second, by providing policymakers with evidence-based recommendations to help revise regulations, but also policies about how to achieve thermal comfort in this type of settings. And of course, last but not least, by providing care home managers, frontline staff and residents with best practice guidelines that are a product of co-creation, working with them in order to empower them to identify the optimum operation decisions for their environments in a warming climate. And last, I'll now move into our project for schools. So it's still early stages, and there have been some delays in this project because of COVID, so it's a less developed project. So we started earlier this year, and it's an interdisciplinary project. We're collaborating with the London School of Hygiene and Tropical Medicine, and again, we have an advisory board with people from industry and policy, and the aim is to address a key knowledge gap. How can school buildings achieve low carbon emissions whilst maintaining high indoor environmental quality that enhances learning and health? And we'd like to create a toolkit really for stakeholders to assess the relative impact of design operation strategies on these parameters. So the focus is on very energy efficient schools, and we collaborate with architecture firms that specialize in passive house school buildings, for example. And this is again a summary of our objectives. So again, it's a mixed methods approach, but it's more modeling focused. And this is because we already have quite detailed monitoring data sets from existing projects, and we carried a systematic meta-analysis of these data sets. And our aim is to develop a school building stock, again by generating a set of UK school building archetypes. So this is the work we are carrying out at the moment. And then with a lot of input from stakeholders during interactive workshops, we would like to quantify the exposure of school children to indoor air pollutants and excess heat in those very energy efficient low carbon school buildings, again using dynamic building performance modeling, looking at a range of building design operational strategies and for the current as well as the future climate. And as I said, we work closely with epidemiologists, and they will help us calculate the impacts of these strategies on education attainment, health costs to the National Health Service by carrying out health impact and cost effectiveness analysis. And again, we'll identify the optimal pathways for improving both indoor environmental quality and learning performance for policy and practice by using multi-criteria assessment methods. So this is going to happen the second year of the project. So again, this summarizes the structure of the project and the interlinkages between the different work packages. So there is a lot of two-way communication between the research team as well as our advisory board and other stakeholders. So in terms of some initial publications, we look at the literature, and of course we identify there is a strong link between indoor carbon dioxide concentrations and temperature in classrooms and performance of schoolwork. So this is from existing literature. Here we are examining an existing database provided by the Department for Education. So the statistical analysis of this database is going to lead to the development of archetypes. So these are the main construction age bands in which we have split up the school building stock, pre-1919, interwar, and so on. And this slide kind of summarizes how we split up the stock and we develop the archetype. So we have different age spans, then a split between naturally and mechanically ventilated buildings, and then a division between primary and secondary schools for different regions in the UK. And this is kind of the frequency of occurrence for the different subcategories. And then we start the development with what we call a seed model, and then through the analysis of the database, we start generating the more defined archetype models. And then the data is then fed into the Energy Plus platform, and with some post-scripting using Python. So the main outputs are carbon dioxide, particulate matter, energy use, temperature, and humidity. But we are constantly revising these through input from our stakeholders. And these are some preliminary outputs where we're trying to quantify how successful our modeling is in terms of capturing energy use. And this is from a recent publication to the Building Performance Simulation Optimization Conference, which was also virtual a few months ago. So what we found from some initial testing of our modeling framework was that interwar schools were the best performing with the shortest time with cognitive performance levels below 95%. And this is the kind of work we plan to do more of in the future. But as I said, there have been some delays because we're hoping to hold an interactive stakeholder workshop this year. Unfortunately, this has not been possible to organize face-to-face, so we've now moved it for next year. But hopefully we'll have this input and this co-creation element, which I think is absolutely key for this type of work. And I'd like to, I don't know how we're doing for time because I can't really see the time on my screen. But I'd like to finish here with some thoughts for further research. So looking at the outputs of these research projects, I think that they all highlight the importance of truly integrated building design, communication between the different actors involved in the design, maintenance and operation of our built environment, and multi-stakeholder co-creation, giving people a voice and allowing them to participate in decision-making in the built environment. I also think that there is a significant knowledge gap in terms of human building interactions. And I think we really need more data at a high spatial temporal resolution on human behavior and building operation across representative building samples. And last, I'm increasingly interested in looking at this nexus of climate change mitigation, adaptation, health, well-being, and inequalities. And I'd like to finish here with just 2 more points. So I was recently involved as a co-guest editor in a special issue of the New Buildings and Cities peer-reviewed academic journal. So the journal is open access, and with my colleague Dr. Sonia Klinsky from Arizona State University, again, we developed this interdisciplinary special issue looking at climate justice and the role of the built environment. And we think that we're trying, it's still baby steps, but we are trying to address a knowledge gap in this area and trying to bring these different disciplinary perspectives together. So as part of our editorial, we develop a framework for architects, engineers, planners, contractors, etc., to start addressing climate justice issues as part of their decision-making process. So our editorial, as well as the papers in the special issue, are open access, so you can visit the Buildings and Cities website and read them for free. And we had a number of events as well to promote the special issue, and some of the videos are also available online. And also last, within ID, we very recently launched our free webinar series, Integrated Building Design, 21st Century Challenges. Again, this is free to attend online. It will take place once a month, usually the last Friday of the month, and you can subscribe to our mailing list and receive notifications and the links to register these events. So this is going to consist of presentations from industry speakers, presenting exemplary case studies of integrated building design in a lot of depth. So we had the first one a few days ago, and it was quite successful. So yeah, if you're interested in integrated building design, please feel free to subscribe to our mailing list and register for the future events. So thank you so much for listening. Again, these are my contact details. Feel free to drop me an email at the end of this event, and very happy to answer any additional questions you might have about our research or have a chat at any point in time. So thank you so much for listening. I'll try to stop sharing the screen now.
Thank you for listening. She finished. Okay, Jim, she finished.
Yep.
Thank you, Anna, for the presentation. Our moderator, Mr. James Walton.
How are you?
Hi, how are you?
Hello, I'm James Walters. I was supposed to open the session and was prevented by technical difficulties. I'm so sorry we missed the opening. Came in on the talk, and we're now in a position, if you are ready, Doctor, to entertain any questions. If I may take the privilege, even though I'm late, of asking the first one, perhaps, and noticing all of your technical work and your education, I'm going to ignore that and ask you a sociology question relative to your subject, if I may.
Of course.
I'm very interested in, you know, as we talk about where we go with building in the future and the points that you made. I saw most of your presentation, the points that you made. The question to me, or maybe to others, is, well, how are people going to act? For example, if one looks at the 1918-19 virus, other pandemics, behavior changes post these events. And I'm just wondering how you, as a professional in thinking about the interior environment, think about how people may be, what they may be expecting, and what might be different. And I hope this is not a curved ball, as we say in baseball, but it seems to me something that's probably thought about.
Yeah, no, absolutely. I mean, this is an excellent question, and it's something that I've been thinking for most of my research and my academic career. I think it really highlights the importance of interdisciplinary collaboration. So I come from an architecture/engineering background, so I don't have a background in sociology or psychology, but I think it's absolutely important that as a built environment discipline that we try to open up and work with people in these fields. So within our institute, we do, and our school, we do have, I have colleagues who come from the social sciences or psychology fields. And I really think we need to have more collaborations about this. So at the moment, I have some ongoing collaborations, and we're trying to seek funding for collaborative projects that look at behavior change. I think it's absolutely key. And perhaps it might be kind of a simplistic view, but I think in terms of promoting behavior change for climate change mitigation adaptation, as well as to address other climate crises such as the pandemic, I think we need to emphasize the co-benefits of potential measures. So for climate change adaptation, it would be that, by implementing such strategies, we are going to create a healthier, more comfortable, more pleasant environment for all. So I think this is what we need to be emphasizing. So it doesn't need to be, doom and gloom all the time. I think there are significant co-benefits. And again, other colleagues within our institute have done a lot of work in this area on quantifying those co-benefits. But I think that this is really what we should be emphasizing in order to attract people and convince them that this is really important to happen.
If I may follow up on that question, please. It's good to hear about the interdisciplinary discussions. I'm not surprised, and I'm pleased because I think it is an interdisciplinary issue, to be sure. Looking at the question of climate change in the broadest sense, do you, certainly one can appreciate the connection between climate change and the pandemic in the sense that both of those, I'll say phenomena for lack of a better word, a call for a number of changes in buildings and behavior and the use of fuels, all the things we know about. Is that second issue, the one I've just raised, is this discussed globally in your circle? I mean, I understand the liaison you're speaking of a moment ago, but what about global conversation about this? Or do when people go to the Montreal Protocol meetings, they just talk about climate change, et cetera? Do you have any sense of that? I hope this is not an inappropriate question, but I'm curious as to your view.
So sorry, could you repeat the question just to ensure that I understand it correctly? So if I...
Sure. My question is, are the issues of human behavior and building environment and a connection with climate change issues, are there fora for this to be discussed globally, not just interdisciplinary, in an interdisciplinary way within a particular country, from your experience?
Yeah. Thanks for this. Yes, absolutely. I think, and this is something I didn't really touch upon it because I guess most of my presentation was about research we do either at the individual building level or at the building stock level in a specific country. But I think that if we look at climate change as a broader issue and a broader societal challenge, I think it's really important that we understand the importance of setting boundaries and then kind of expanding them. So we do touch upon this in the special issue I mentioned, how we define externalities and how we define response to climate change. So I think it's really, really important that, it's not enough to reduce our emissions if all of our goods are imported from other countries and we ignore those emissions just because we have set up the boundaries in such a way that it's beneficial for us. So what do we define as externalities is really, really important, and it needs to be acknowledged more. I think it really needs to be it's a global problem, a global challenge, an unprecedented challenge. And so I think there needs to be a global discussion.
Very good. Another thought that comes to mind is again, this is sort of a pedagogy question. Assuming that behaviors will change to some degree, we don't know what. Assuming that we have incentives to improve, yet not fully defined interior buildings where people live, work, etc. How important do you think the messaging of that importance is moving down below the, I'll say adult age, but into, what we would call high school and below that in the United States? Is this talked about at all in your experience? Do you have any experience with this?
Yes, so yeah, I think it's really important, and I think that perhaps the younger generations are much more proactive, if you'd like, and much more open to such messaging. I have colleagues who have actually, it's something I want to do as well, but I kind of never had the opportunity. I have colleagues who are doing, running interactive workshops with schools. So primary, secondary school children, and they're demonstrating, building physics and some of the work we do in an accessible way. And they're really amazed by the engagement of students. So I think the younger generations are will definitely play a big part in this. I mean, we have Greta Thunberg as a great example of this. So absolutely.
Very good. I wonder, for example, in your community, professional community, do you, not you, but there's one in your position, following on that question, have an opportunity to talk with school officials or governments that manage schools about indoor air quality?
Yeah, so it's perhaps something that we don't do enough of, but I think there is a significant push in the last few years to do more in terms of public engagement, and schools and governors and school communities are a big part of this. And in fact, as part of the Impact Generation Pathway Plan, we had developed as part of the Aspire project that I present towards the end of my presentation. We were intending to have this kind of workshops with school communities. Unfortunately, COVID-19 meant that a lot of face-to-face activities that we're planning cannot happen at the moment. But we do want to do more in terms of public engagement and working with communities, co-creating, co-designing solutions, and really, as I said earlier, empowering them, making them part of the solution.
I'd like to follow on that. I'll give you an example of something that my organization is involved in, and then attempt to make a parallel. Currently, my organization, HRI, is working with UN Environment to focus on the training of technicians who will service HVACR equipment when the new refrigerants come into play. And as you know, the new refrigerants, the lower GWP, have characteristics not common of the refrigerants we are used to. Explosive, toxic, flammable, etc., to various degrees. Now, given that small example, and this is a question that it just came sort of out of left field, as we say in baseball land. Do you think there's a role in any kind of UN agency activity that maybe you all have talked about, or that you might think about, for making this a more global, part of this, in any case, a more global approach, or part of the UN program? Has that been discussed at all?
Yeah, it's not something that I have discussed in any detail, but it sounds beneficial, definitely. So having standards and and kind of best practice, I think it's really important across professional settings. So yeah, I think again, I don't know very much about this, but it definitely sounds as something that would be very beneficial.
You mentioned a very interesting. You said a very interesting word: standards. What is your view on whether the standards for what defines good indoor air quality are settled or dynamic or just a complete mess? I'm not suggesting they are, but I'm just trying to get a scope. Yeah.
So yeah, I think it's quite a complex issue, and I think it's again because of this fragmentation of the construction industry. It's really difficult. I mean, I find it quite difficult even when I work with my MSc students and they work on their projects. There is not one piece of documentation they can consult. They have to suddenly collect, ASHRAE and SIPSI and lots of other documents from different organizations. So I think we definitely need to kind of create some more, unified guidance. On the other hand, there are issues such as, the subjective nature of, for example, thermal comfort, the fact that according to WHO, there are no safe thresholds for indoor air pollutants. So there are some inherent challenges in defining what a healthy, comfortable indoor environment means. But the fact that there are these challenges, it doesn't mean that, we should give up trying to define this criteria. And I've been in many working groups over the years trying to define overheating criteria in the UK. And again, because of the subjective nature, or it can be quite challenging. However, I've seen that things rarely change voluntarily. It's usually, you'll always have the pioneers and the buildings that achieve LEED and BREEAM and WELL ratings and so on. But it's really the building regulations that drive changes and improvements in the building stock in most countries. So I do think that we need to have those definitions, even if they're not perfect.
And that's a point well made. In particular, as you know, my organization is, the members of my organization are manufacturers of HVACR and water heaters. So we have the question I have for you is, do you, in all of your excellent work, do you have either regular or irregular or never or occasionally conversations with manufacturers of equipment that in fact will have to adapt to whatever is different?
Yes, so perhaps not so much myself, but I have other colleagues I work very closely with that deliver the mechanical ventilation and active cooling components of our programs, and they work very closely with industry. So we have industry members sitting in our advisory boards for all of our MSc programs. And, when we develop a research proposal, we always seek letters of support and invite people from the industry to participate in the project as project partners. We really value industry perspectives. And we had some very interesting discussion with Nesrine and others in the morning about this need to build this community of practitioners and academics and policymakers and others. And I think it's really, really important that we really feel as members of the community, respective of whether we sit in an academic institution or a company and so on, and we have this constant two-way dialogue. And we were saying again this morning that it's important that as an academic institution we respond to the changes in the market, but at the same time we're also able to shape it and influence it.
I would think, yes, I think your characterization is exactly right. I think there is influence from the communities that you work with. There's no question about that. Looking forward, when one stands back and looks at the world, if you will, we see, what do we see? We see almost 200 countries or 200 economies, from large to small to very small to very large. We see a different political and regulatory pattern among them. Some would say some are extreme, some not extreme enough, etc. The usual quilted patchwork of how governments govern. Do you see this as providing a a barrier or something that can be managed in trying to accomplish achieving safety for the individuals in the buildings, etc.? How does one deal with 200 countries?
Yeah, so it's a very big question. So I don't
It's
know
very big.
if I have a definitive answer to this. But again, I think we should really go back to the issue of inequalities. So what I said earlier about how do we achieve a socially just environment, and we ensure that we I think the focus should really be on equity versus equality. So not everyone will need the same solution. So identifying, quantifying, and acknowledging vulnerabilities to climate change or other risks such as the current pandemic we are facing, I think is absolutely important. So I think this would be the first step towards achieving this target. So I definitely think that we need more research on these issues through a social equity lens, both within countries as well as across countries.
Yes. If there had been no COVID-19, if we could turn back the clock to February or January, whenever, and you were working on what you were working on in January and February, and this may test your memory a little bit, what do you think, if any, is the biggest difference in how you're looking at what you do because of COVID-19 versus before COVID-19?
Yeah. So I guess I was saying that perhaps, I mean, it's a horrible situation. It's a horrible pandemic with terrible effects. But perhaps a silver lining of this situation is that potentially there is now increased awareness of the importance of indoor environments, because a large proportion of the population has ended up working from home in buildings that were not designed. Before, a home was there for family time and recreation and rest and so on. But now it's used as an office space, as a school environment, place for exercise and so on. So I think people might realize how important the various aspects of especially residential building design are. But I think something that comes up in my conversation with colleagues again and again, especially in the last few weeks, is the issue of ventilation. So I mainly teach natural ventilation, but of course I work with colleagues who are experts in mechanical ventilation strategies. And recently we had some recent guidance published by CIPSI in the UK on ventilations for COVID risk transmission reduction. And so typically I would say that you need ventilation in order to achieve indoor air quality, but also during the summer for its potential cooling benefit and so on. But now we add COVID-19 into the mix and disease transmission. So there is this conflict there, this huge tension between requirements for health in terms of the reduction of COVID risk and transmission, so increasing ventilation rates. But on the other hand, we are now at the start of winter, and heating has been switched on in most homes across the country. And I mean, what do? Do you leave your windows open with a radiator on? You know what I mean? So there is this huge conflict between what we need to do to fight this pandemic in most buildings and what we need to do in terms of meeting our climate change mitigation targets and reducing our carbon emissions. So I think it's a very, very interesting tension. I don't know if I actually have the answers to these, but it's definitely a research area that needs to be focused on much more.
Well, if I may, what your comment brings to mind is about this tension is exactly right. I'll give a very brief example. Our offices are in Arlington, Virginia, which is directly across from Washington. The weather in Washington is terrible in the summer. It's very humid. Washington was actually built in a swamp, so it's below sea level. It's been built up, of course. And so 50 years ago, people were, without air conditioning, were actually keeping ventilation to some degree, but pulling down the shades, closing the blinds to keep the sun out. Now, the building that I work in now, which is a relatively new building, and you cannot open the windows. And they simply don't open because the value of being comfortable has overwhelmed the issue of ventilation. Now, I'm not saying that as a critic. I'm just saying that's a fact in many places.
Yeah.
I think this is going to be a big challenge for the industry and for people in general.
Yeah, absolutely. And
I'm checking. Go ahead. Sorry.
Oh no, just to say that
Go ahead.
in many buildings we also have window restrictors for safety and security reasons. So you can't really open them above 10 centimeters. That was the case in a lot of the care homes we surveyed as part of that project. So this is something. It's a challenge for the industry and for users.
I'm just going to pause a second and check the chat characteristic here, the chat function. Well, the two things. Number one, again, I am so sorry that after I practiced so hard to say your name correctly and get your background correct, the technical difficulties kept me away from the introduction.
That's absolutely fine. Of course.
I'm pleased that I was able to meet you this way and to come in and to hear your answers. I believe it's been a very helpful, constructive session, and I just thank you very, very much and wish you all the best with the work you're doing. It's exciting and it's also necessary.
Thank you very much. No, thank you very much for your questions and for facilitating the session. And again, thanks to Nesreen for inviting me to this session as well as the panel discussion in the morning. And of course, to the other people attending. Thank you so much. It's been really interesting.
Yeah.
Thank you.
Thank you very much, Anna. This has been a pleasure, and I look forward the attendees also coming tomorrow. And if you get the time, please browse through the conference exchange and look at the different presentations and the papers that people have contributed to this conference, in addition to a special session that has been specially prepared for rebuilding Beirut. And that was organized by Mr. Bassam Al-Assad. So we look forward to you joining us again, not only in this conference, but also when things, calm down, in a real face-to-face conference, or maybe a collaborative project where we learn from your experiences doing things at the city scale, as you've done it in UK. Many thanks.
Absolutely.
Thank you, James, for
very much
for the moderation.
Well, at least a half a moderation. Thank you.
Thank you. Bye-bye.
Thank you.
Bye.
Bye. Bye.
Bye.